Another question here for Peter. It seems that the microphone's a long way away, but there's been some controversy about the level and whether women need to take iron in pregnancy. And I know there's many preparations that are on the market. Can you give us your thoughts and the summary of knowledge that we have about that area?
The fascinating thing about pregnancy is that women, like most female mammals, in fact all as far as one knows, undergo extensive physiological adaptation, and one of those is an increased uptake and transfer of iron from normal dietary intakes of iron. In other words, the bioavailability of iron from the diet is increased during pregnancy. The point that then has to be considered is just whether or not there's still enough iron being taken up by women. And this is the contentious issue, but not only just during pregnancy, but probably during early lactation or throughout lactation as well. The consensus opinion often varies from one advisory body or advisory committee to another. In the United Kingdom at the moment, the standard advice is that women are monitored and they're given iron supplements if there is evidence that they are becoming iron deficient. At one time I thought that was also the case in North America and in the USA, but I've been hearing recently that there is another large group of advocates emerging who are saying that this is an unsafe approach and that women should routinely be given iron supplements. I do not necessarily think there would come to any harm from having responsible doses of iron supplements, and indeed if they are getting enough iron, any surplus iron which they do not need would not be absorbed and would be lost in the stools. So it might be a futile exercise, but in the ideas of some people, it would be a prudent exercise. In other words, a precautionary measure to avoid any risk of deficiency. Unfortunately, the women who might well need the iron supplements are probably not women or young mothers, adolescents, for example, who would necessarily take supplements. So I think that whatever one does, it does not preclude the need for close health professional supervision throughout pregnancy, so an eye can be kept on the need for iron or not.
Maria, you did a study a few years ago where you gave low-dose iron to women in pregnancy, and there were some results there that were a little bit concerning. Do you want to tell us a bit about that?
Yes, certainly. I would certainly endorse the comments that Peter is making in terms of the screen and treat approach. We certainly did see that as the doses of iron increase during pregnancy, there are more women reporting gastrointestinal side effects. So black stool, gastrointestinal discomfort, so that is a comfort issue for women. In the 4 and 8 year follow-up of the children that we measured their development, overall there were no differences, but there was this surprising issue of slightly higher problems to do with peer relations in the behavioural aspects of the children from the women with who took iron supplements during pregnancy. That was not a primary outcome of the study, so we do need to interpret it with some caution. It was surprising to us, though, that it was there at both 4 and 8 years of age.
Maria, would you want to translate that into the fact that my daughter is going to want to have a baby soon, and she's thinking about having iron supplements, and she eats regular Australian diet with meat and 3 veg and so forth. Does she need iron or not? Would you encourage it?
I wouldn't encourage routine supplementation, no. However, she should be monitored by her obstetrician, and if there is any evidence of iron deficiency and iron deficiency anemia, then an appropriate supplement is warranted. However, I don't think there is a need for her to take any extra supplements over and above that.
Peter, would you just, like, while we're on the iron thing, do we really need meat in order to get enough iron? I mean, the Indian subcontinent seems to survive largely on a vegetarian diet. Is there a supply? Can we get enough from vegetables?
Sorry, can I ask Maria first? What is the situation in Australia about iron supplements?
The obstetric guidelines, the College of Obstetricians recommends a screen and treat approach, but there is a lot of consumer advertising for women to take prenatal supplements, but the medical profession advocates a screen and treat approach.
Fine, I think that's probably the general position certainly in many countries, but obviously there are different problems in those where there are endemic infections of the gut. As regards dietary sources of iron, which is essentially what I think Bob is asking, meat is undoubtedly a good source of iron, not only of inorganic iron, but particularly, of course, of heme iron, which is a form of iron that is taken up by the gut mucosa fairly efficiently, and it also contains other forms of iron that Bowes research has recently shown is also taken up by the gut mucosa. Whether or not that iron always gets transferred out of the gut mucosa into the body depends on how much need the body has for iron. There is now a better understanding of how the mucosa exercises its control of how much iron it takes up and transfers into the body, namely absorption, the two processes of absorption. If one were to rank dietary sources, meat and similar products would certainly be higher as a source of easily available iron within the gut lumen against many vegetable products where the iron is complex and is not so easily available. But the striking thing is that I don't know necessarily about India, because there are many confounding issues there, but many experienced vegetarians, and in fact populations of vegetarians who have been compared with omnivores, still, although they may have indicators of iron metabolism that suggest their body content of iron is slightly lower than that of the omnivores, vegetarians are usually within the reference range. But can I pass this over to Bo to polish off? Do you have some other points?
No, I totally agree with what you're saying. I think it's quite feasible with a non-meat diet to meet your iron requirements, but you need usually to know a little bit more, but in general vegetarians know that little more in order to cover their needs. But in developing countries that is another issue, and therefore I think we see a lot of iron deficiency in populations that have a vegetarian diet. I would like to come back to what Maria said about discretion about using iron supplements during pregnancy. I think we have to, as scientists, be aware of the drawbacks on how we sometimes do studies. We did a study on infants in Sweden and in Honduras, and the reason we did that was that WHO was considering changing the recommendation for giving iron supplements to infants to lower the age. And we did it in a double-blind fashion, a large study funding by the US Department of Agriculture. And what we found in Sweden was there was no benefit of giving iron earlier on, but in Sweden we saw a significant negative effect on linear growth. That is, they were shorter when they got iron early on. In Honduras, we didn't see that first, but then we realized that in Sweden, virtually all infants were iron sufficient. Their iron status was good, and they got iron supplements. When we divided the Honduran infants into those that were iron sufficient from the beginning and those that were iron deficient, those that were iron sufficient also showed a decrease in growth. That means that if you get iron and don't need it, you have a negative effect. Iron is not an innocent nutrient by any means and can create a lot of things in the body that we don't want to see. The deficient ones benefited, no doubt about it. But it's the same thing with pregnancy. Most studies looking at iron supplements either select a population where the women are iron deficient, and you usually will see a benefit, or you take a population in developing countries where largely most women are iron deficient, but never ever are they split up into those women that are iron sufficient and those that are deficient. And we have at least started doing animal studies, and what we see is that during pregnancy, if we give rats that don't need iron a little bit of extra iron, just the same level that you would give pregnant women, there's no adverse effect on the women. There's no adverse effect on the infants. But when they are weaned and get onto an adult-type diet, their iron metabolism, their iron homeostasis is affected permanently. So I would agree with using some caution of giving iron supplements to women that don't need them during pregnancy. It is a very potent nutrient.
Thank you, Bo.